name?
I'm anonymous today.
I can see that. How are you doing now?
I'm good. How are you?
I'm good. The grandkids are good?
They are. Everybody's good.
Oh, that's good. That's good. I'm glad.
Yes, me too.
So, Professor Pam, Mrs. Behuniak, that's one of the teachers from Buffalo.
Hi.
Hello. There's Mr. Raymond there. I don't know if he's still hiding or something. He's from Virginia. And then Miss Catherine from Florida here, West Palm. You remember Catherine Dudek?
Yes.
Yes, she's there.
Oh, yes, I remember. Let's
Yeah.
see. Hi, Catherine.
I think she's hiding.
Okay.
Good morning.
How are you?
Great, thanks. How are you? Good to see you.
I'm good, thanks. Good to see you too, although I can't see you.
So I'm like, you can see her. She's trying to hide, and she's trying to be anonymous like you.
Oh, okay.
No, that's okay. Yeah, so a few more minutes, people are coming in. That's good. Thank you guys for coming early. I appreciate that. Definitely come on.
Going on, Raymond? All right.
Okay. Yeah, so in the beginning, probably the first 30 minutes, I'm going to go over what the organization has been through, and then what we are planning for next time, for the next medical mission. And then there's places that we're going to ask people to volunteer and join in the medical mission. So it's exciting. There's so many things to do. And we have so many people who are expert in their own field and willing to help us. So that's even better. That's very good. Jones?
Hello. How's everybody doing today?
We're doing great. Thanks for coming.
Yes. I got to hear what you got to say, doctor. I got to hear it.
Oh, I appreciate it. We need a prayer warrior with us.
I hear you.
Hey, Lady V.
Good morning. How are you?
I'm good. Habari za asubuhi. Oh, mchana now. I see you're writing the 2021 medical mission, okay?
Yeah, I got it out. I put a few wrinkles out of it. I still can see some wrinkles, but hello, everybody.
That's good. We need to change it and put it to the 3 now. Hey, Miss Ray.
What?
I said we need to get new t-shirts. How are you, Miss Theresa?
Great. How are you?
I'm good. Thank you for coming.
It's good to see everyone. I'm excited.
I know we are. I mean, we're gonna put you to work. You are needed everywhere. Remember, we cannot survive without nutrition. We are needed everywhere. So thank you for coming. Definitely. And you see, we can feel you in everything we do, and then so we're gonna give you a very tight schedule.
Nice, exciting.
Yeah, so I'm like, I can't wait. So one more minute, then we're gonna start, guys. I know there's a lot of people are coming, but people from the anesthesia group, I think half of them are working, so we see them as they can come in. But yeah, in respect for your time, we're gonna start. So good. Okay, so welcome to the annual summary report from QHSC, and I'm sure everybody knows what the QHSC is. So it's Quality Healthcare Solutions and Consulting. So our goal is to educate and train healthcare workers globally, and we are hoping that we can reach beyond our 4 walls, borders, continents, and we can go everywhere and go and try and share our knowledge and also learn from them. So the organization started 2019 officially with the name, but before that we were just a one-man show, and we knew that one person cannot do it. And then so the first medical mission we did as a group was 2019, and then it was for 5 experts. So Mrs. Behuniak was one of them, a teacher from Buffalo. So thank you very much for being an ongoing support and active participant for the QHSC. And then so last year, 2021, we had 20 global volunteers. So that was a huge group. And I thank every single one of you, even the people who did not go and help us along until to get there. And there's a lot of people did a lot of things behind the scene to help us to get there. And so I'll give you some of the pictures when we start sharing my screen. But it's just like, it has been a blessing, and it has been a rewarding experience to see all of you guys who are very dedicated to improve human lives. And we go to the hospitals, go to the schools to try and do the best we can, just to at least affect one person. So if we can save somebody's life, just one, we have done our work. And if there's 100 of us, we save 100 lives. So if we do more than that, that is an extra blessing. So again, thank you very much for coming. And so we're gonna go over and see what QHSC about. Is there any questions before I start? If somebody has a question, comment, request. Everybody can hear me just okay?
Yeah, Dr. Mlawa.
Good. Hi, Dr. Mlawa.
Hello,
Hi, how are you? He's all the way from UK. Thank you for coming.
I'm all right. I'm still at work.
Oh, that's good. That's good. Some of the people have to work when we are home. But thank you very much. Dr. Mlawa has been a great supporter and ongoing contributor for QHSC. So we have plenty of things to ask him to do, and he always says yes. So thank you again for coming. Ms. Sandube from New York, thank you. Thank Mr. George from Ohio, thank you for coming. And I see somebody with a nice car there. Hopefully we can get a ride someday. I don't know. Oh, Dan, okay. Okay, so if nobody has any questions, as I was explaining before, I'm just gonna go through what I prepare and just give you a background of what is QHSC has done, and then what are we planning to do. As I said, 2022 is an ambitious goal, so get ready, and I'm gonna need all your help. So I'm gonna share my screen, and then we can start to go over what I have.
Yes.
Okay,
Yes.
Thank you, yeah, thank you. Okay, so we have a meeting, and we have board members, but I'm gonna talk about the board members in a few minutes, but let's just go and discuss what we plan for today. So, of course, the meeting is called for today at 12 Eastern Standard Time, that's the US time, and then 2000 for Tanzania. We are going through the Zoom. So, past activities. So, we did a medical mission 2021, that was from September 12 to September 29th. And we planned a lot of education activities, and we went to Dodoma Christian Medical Center Trust, and that we were there for 8 days. And then we also, Dodoma Medical Center works with Nicu primary school. So we went there for 1 day, and we were able to see 1,500 children. So there's a little explanation in a little bit later. And also we went to Magnet Youth Association. So this is the youth, they play soccer from age 6 to 17, I believe. And we were there for only 1 day to do health promotion and disease prevention and addressing minor injuries. Because remember, if you're working with pediatric, they always gonna hide. They don't wanna tell you if they're injured and they continue playing. Unfortunately, if they do that, then it will impede their athletics abilities. And then, so of course, we work so hard, then we always have to have some time to rest. So we went to safari for 2 days in Mikumi National Park, which is in Morogoro. That was on 22nd and 23rd. And then 1 day in Zanzibar, because some people here wanted to see the, to touch Indian Ocean. So we were able to go there, although we got there late, but that's okay. Next time we're gonna plan it better to make sure people are going, actually put their feet on the Indian Ocean. And then, so one of the things that we were there just for feasibility and see how we can do, and we went to Mumbai Nicu hospital there. We were there for almost 6 hours, and also we went to burn unit, and where Miss Victoria Jones has been an instrumental person to connect with burn unit in Muhimbili. And then, so we're gonna have more details for what we're planning to do for 2022. So, who are those global volunteers? So we'll have 20 of them, 10 actually coming from the United States, who physically went there. And then 4 of them were from still United States, but they were doing virtual training. and then 6 were actually from Tanzania. Some of them were nurses, some of them are doctors from Tanzania. So it was a bigger group. So this is one part of the group. And sometimes it's hard if you're working in the healthcare places. So some people will be in the unit working, some people will be taking pictures. So hopefully we try to get a group picture where everybody's there. And then, so this is when we were going to Magnet. So we were going to do working with those children there. There were 100 of them and 10 athletes, and then I believe like 35 coaches. So there was a huge group over there. So there's all this discussion I'm telling you, we have videos on YouTube. So next time, if you need to see the background in extent, like what exactly do we do in each area, we have those YouTube on our channel, Dr. KARIBUNI QHSC. If you Google it, you should be able to find it on the YouTube. Okay, so how did we get there? So we have, I need to thank you, every single person who donated, starting from $5 to $1,000, individual donors, and then also specifically people who were involved in raising money for the organization. Ms. Catherine Dudek, she did through the GoFundMe and Facebook. Ms. Levine also through Facebook, through the birthday. Some people who technological savvy, we should know that. Miss Valentine did the same thing. Miss Jacqueline did through the birthday for Facebook. And then we have a lot of anonymous donors who we thank them even if we can't use their names, but that's great. So through GoFundMe, we had almost $2,728.12. Facebook, we had $746.96. Cash App, we had $185. Venmo, we had $255, and the total cash, like people gave me actual money and checks, so that's $400. So we are all grateful for all these donations. And on top of that, people gave us things to take. So this is a picture that all the, almost half of the group of the volunteers from US, we arrived in Dar es Salaam, Nyerere Airport, International Airport, and we have 26 bags of 50 pounds each to go and deliver to Dodoma Medical Center. So it was a huge, and the schools in Dodoma. So it was a huge collection of supplies. And as I said, more videos are posted already for what exactly was in there, and starting from thermoregulation, which we bought the clothing for the babies who were born when we were there. Every single baby got one, the whole set, and then to supplies, mask, face shield, PPEs, I mean, all the band supplies, gauze, I mean, there's a lot of stuff. So if you are interested, please go and access those videos and then you can see exactly what it is. So to tell you what we have the budget for 2021, cash at hand from Global Volunteer. This is the money that volunteers, individual volunteers who went there actually donated to go and cover their accommodation, transportation, meals while we were there, and the safaris. And then so what we collected for the individual donation from Facebook and everywhere else on social media was almost $4,000. And then corporate sponsors, we had 2 of them purposefully who gave us the cash. And then we had a corporate sponsor who donated all the training that we used in Congo and in Dodoma, which almost was like $700 there. And then we had corporate sponsors who are in Tanzania also gave us almost $800 worth of activities and supplies. We did have the in-kind donation, people who collected the pencils, the pen, whatever, backpack and stuff. That's just an estimate. I believe it's more than that, but we had to put a number there because, as I said, to fill out those 26 bags with a £5 each, I mean, so 50 pounds each, it's way different, more than $5,000. But we have to put that figure there. So next time when we're doing this year, we're gonna try to map it as we collect stuff. I mean, even if somebody gives 10 pencils, we need to itemize so we can just have an accurate estimate of what we are collecting. So in total, roughly, we had almost $25,000 worth of the medical mission from 2021. This is a huge jump from what we did for 2019 because it was close, I think, to $8,000. That's only 5 people who were going over there. So that was a big jump. But this is because of you volunteers like you guys who are here providing your time and being willing to help us. So thank you again, and thank you, and thank you. We cannot thank you enough. Okay, so this is just a breakdown of what I was just telling you, the individual and the dates that we collected, and because we have to do that for taxes purposes. Okay, so what did we teach for 2021? We did so many things, and that's what I was saying. Like Dr. Mlawa did help some of them here. Anytime you hear diabetes, the professionalism and stuff, we get to Dr. Mlawa and get him back quick to come and help us. So thank you. So we had the first health conversation, optimal customer service, practice in diabetes care. So we got the professionals over here and in Tanzania. So we make the video, and then of course we released that. So we had 163 people who attended, and then plus 27 who people see it live on YouTube. And then we started the survey to try and find out about the nursing clinical research, and we had those numbers right there. And then another presentation, it was nursing clinical research, which we actually have global researchers talk about how can the nursing impact their everyday work by doing research or clinical research, even as small as, hand washing. How many people are washing hands in the unit, and then how many infection rates for that month or for that 6 months or a year. So those are little things. So we had to we discuss different options. You're interested in the research, please observe those videos. And all this is going to post it online. So you will be able to click on those videos and be able to, those links, and be able to get those videos. And then we had the inspirational pathways. We get expertise from everywhere else to try and tell them why they chose nursing. So this was just to inspire people who needs to come in and join the nursing profession. And this was not only restricted for nursing, but this was specifically for nursing, because from the survey, people wanted to know, like, why did you become a nurse? And what are the things that I can do? So that's why we focus in the next conference about inspiring those people who are still undecided. So we encourage them that part. So if as a doctor, if you're in the group and you feel like, okay, we need to try to inspire people for that area, then definitely we love to have a group of you guys and then do the real presentation to try and encourage. Because with this COVID, it's a lot of things that has happened, and we lost a lot of healthcare workers. And then so having an inspirational communication or presentation to try and help people who are undecided or people who are different professions to try and come back to healthcare and try to help us, it's always a good thing. So if you're interested, please share those interests, and then we try to get you going. So when we go into Nicu Primary School, as I said, we had 1,500 children from 1st grade to 7th grade. So we did the dental hygiene, hand washing. Those are basic things, but with this COVID right now, the children need to wash their hands, whether before they eat or after they eat, before they go home and before they touch their face and everything else. So it was a very, very rewarding experience. Again, you will see that in some of the videos when we're talking about only teaching the Nicu children. We also went to Kongwa, that's another at-risk schools in Dodoma. And these are the children who are at risk. These are the children that the government have identified that at risk. These are the kids who probably don't even get 1 meal a day to even survive, and later on they have to go to school. So we were lucky enough to be able to go there, and thank you every volunteer who went there, and including Miss Victoria Jones, who collected some bags for these children. So we were able to give them at least those 100 children who were identified, to give them all the backpack and all the school supplies on their backpack. It's a beautiful thing. If you can please watch the video for summary from the report of the medical mission, you see how the children are so happy. Toothbrush, toothpaste, all those little things that we take for granted here. Just one toothbrush, which is less than $1 here in the United States, for the child who had never seen a toothbrush, you will be amazed that the little thing you can do here to help and save somebody's life. So those are the things that we're really focusing on. And then of course we did the postpartum hemorrhage for the nurses at Kongwa, postpartum prevention for postpartum hemorrhage. And this, of course, they have labor and delivery and maternity wards, and then a lot of their patients either get those complications and could end up dying from postpartum hemorrhage. So we did a little training, and it was a very interactive training, and they appreciate that. So we definitely know there's a need, and we're going to incorporate this for the next medical mission. Of course, we did the health screening for the Youth Soccer Association. There's 100 kids. So these are the ones that they're playing soccer. And then so we wanted to make sure they're eating healthy. That's where Miss Theresa is coming in. They're eating healthy, balanced diet as an athlete. So what should they eat? Because remember, kids, if you don't tell them anything else, they want to eat pizza. Pizza is great. I don't have anything against pizza. but you cannot eat pizza half an hour before you go to play your game. So it's not going to work. So these are the things that we had to go and do. And then thank you, Ms. Christine and Ms. Catherine and Ms. Victoria and Valentine's and all the volunteers that were there. We started teaching them, Mr. Marsha, teaching them how to, like size my plates, we call it here in the US. And then so what type of food they need to eat. And then the kids were so interactive, but we need to do more for them and try to do the health screening. We are checking them for BMI to make sure, okay, is their weight appropriate for their age? As an athlete, they have to eat more. What type of food do they eat? So it was very interactive and we have a lot of data. And I'm sure Dr. Sambi Chaka and Dr. Fabian now and Ms. Theresa Cooper, we can help us to, identify it before we get there to see the kids who are at risk as an athlete. Because if they don't eat very well, chances is they're going to break their bones. So we need to make sure we address that and help them that. Of course, towards the end of the year, we did the holiday message, which we had a lot of volunteers and team QHSC members and send a holiday messages. So interested, please watch that. That video is very short, like less than 5 minutes. Okay, so more of the completed activities. Of course, we also have our sister organization in Tanzania, which is an NGO in Tanzania. So a lot of stuff that we do here in the United States to go to donate in Tanzania, we have our sister host, NGO to try and present it to where we are supposed to go. So the sister NGO has exactly the same name. So it's always Dr. Gaboni in US or Dr. Gaboni QHSC in Tanzania. So we had also QHSC in US donated 200,000 shillings, which is like an $89 to buy for children who are at risk, don't have insurance and they are athletes. So we have to pay for 4 children's health insurance card, which is worth 50,000. Yes, it looks like it's a lot of money, 50,000 shillings, but here in the United States, 50,000 shillings is at $23. That's a health insurance card for a child for a whole year. So this was in the beginning. So this is something that we need to explore and try to help those children who have never seen a doctor, even a single day in their life. And then so paying for their health insurance, they allow them to be able to go and be seen. One of them, I think, has a fracture in her knee, so they need to go and do all this x-ray and stuff, but since they didn't have insurance, they never went. So if we can help these children, as I said, if we save one child's life, we are doing our work. And then, of course, we had another fundraising. These are the things that I will encourage you for the volunteers to come and join us. One of these fundraisers by Ms. Catherine Dudek. She went through California Pizza Kitchen, so we were able to advertise one day of the of selling that pizza, so to raise the money for organizations. This is almost like a zero trial, so we know this is what we need to do. And thank you, Ms. Catherine. So now we're able to raise almost close to $227 from that. So, I mean, that is a big thing. That's the money we didn't have. So all those things could be able to pay for things. So for all that activity that we did that last year, and we had, of course, a number of meetings. So again, these meetings also are posted in the YouTube. We have, of course, in the beginning of the year, of course, COVID was getting crazy over here still. And then so some of the meeting we have to postpone it because majority of the board members and they were not able to come to the meeting, and we had to do by just writing the statements and give updates. So we were able to do the June 19th, that was before going to the medical mission. And then we had the preparation. So we met all the global volunteers who were going in that mission. And then that's the summary when I was telling you, after we came back October 17th, that's when we share all the activities that we did. And it's a very nice summary, lots of videos. So if you want to get excited, you see what exactly the medical mission look like. So please watch that. And then of course we had the Thanksgiving message and the holiday. Okay, so what did we do? Like how many people did we see when we got there? Okay, so this is just a little summary. All the topic on the left, you can see, these are the topics that we plan ahead and then went and taught on those days that we were in the medical mission. And then so we were able, I'm not going to, this is posted also on our website. So if you look quickly, there was 20 global volunteers who provided education for a number of people. So there was almost like the children, so there were almost like 2,067 individual people received education from the medical mission. and from the global volunteers. So that is a huge part. So this is almost, we spend almost 8,000 hours, 833, if we count individual volunteer those hours. So if it was only one person who was supposed to do all this for all these participants, then you take 368 days. That means you take almost more than a year if there's only one person teaching these things for every single day. So it's a huge impact we are doing. And now it's going to be even more than that when we're hoping to recruit even more than 20 people. So as I said, we are being ambitious. Any questions so far?
Lucas said it's not.
Somebody has a hand up?
Lucas. What don't you?
Maybe those saying just had.
Oh,
Okay, I mean, if somebody had a question, you can just start talking so I know if somebody's talking. If not, let's just ongoing. We're almost finishing with the report and then we allow people to start talking. Ongoing activities. So with all this planning of the medical mission, it requires a lot of behind the scene, and all these are done by volunteers. These volunteers are not paid by QHSC. So we are praying and we keep opening our hands to God to try and give us, to bless us and get all those big donors and sponsors so we can be able to cover all these expenses for the organization while we are planning and make sure people can donate more time to planning more efficient activities. So we are still working on Amazon Smile. So if you shop at Amazon, you don't pay anything extra as long as you just identify as Dr. Gaboni QHSC as your charity of choice. And then so everything you spend, we get 0.05% of what you spend. So it's a little bit a small amount, but if you are shopping there too much like me, we were able to raise $82.29. So remember, that's the money we did not have. So that money could help us paying on those little small daily functions for the organization. So what expenses do we have yearly? So we have, like, for the website, subscription is almost $354, and then we do the survey, so that's $5 a month. And then of course we have all the expenses. Bank account is $5, and then of course filing for tax, so the names and all those stuff, all those things are just bookkeeping stuff. And then all those things, it depends on at the end of the year, like now in February, we're trying to get all those things squared away. So those little expenses have to be covered somehow, and that's what I was talking about, those using Amazon Smile and people who are donating times. That helps also to pay for those covers. The same thing for our sister organization in Tanzania. They have specific expenses like annual charges. It's almost like $23, and then of course financial statement. Preparing the financial statement for the organization is like $200, which is shy of like $90, and then the audit fees $300. So it's almost like $130, almost $140 something. And then of course we have the lawyer who prepare all those stuff. So those expenses are covered. Usually we have the annual board members who usually contribute throughout the year, but or pay once a contribution amount is like $1,500 for last year. And so we're gonna do probably something different this year to try and encourage people who are members and contribute a little bit, but that's gonna be open for discussion for this board, which is at this year. And then we see what the best way to present to everybody. So everybody's gonna know. So as of now, the bank has a bank account, sorry, has $1,525.65. It's a very small and it's very young organization, but I believe we are blessed enough that we're gonna get more than that. So, but with that, we were able to do everything in 2021, and I believe we can do better than that. So thank you again for even thinking of joining the meeting to be able to come and show your interest and show your support and your expertise. I'm sure next year we're going to have a different story about that part. Okay, let's go to the good stuff. As I said, we discussed about paying them. So for coming this year, sorry, we are going to still do the 4 meetings, usually do quarterly. And then today's meeting is just to encourage all the members and everybody else just to know what we do in QHSC. And then so for the board members and executive team are going to be meeting 4 times a year, and these days will be revised as we meet with the new board to discuss if it meets their availability, and then we can adjust that. But at least by the bylaws, we have to have at least 4 meetings per year. So when you are decided to join and become a board member someday. So just know that usually we have 4 quarterly meetings, and then so this is the one that usually allow us to plan ahead for these activities, and then just to make sure QHSC has can sustain its expenses and planning for the activity to try and meet our mission for this organization. Okay, so we try to spread our name out there using the social media. So this is the for Facebook, that's the name, the Twitter, the Instagram, and the YouTube, and the website is right there. So all those things that if you have chance, please join them. Go over there. If you get to the YouTube, please subscribe and share and likes. So the more we have that, we have an ability to be able to reach even more people. We get more space in the YouTube to be able to reach more people, and hopefully eventually we'll be able to start making money from there. So if you have an idea and you have technological savvy and you try to help us, please, I'm all ears. I'm happy to hear from anybody who wants to do it. We have a few collaboration in the web, so we're gonna work with Mr. Smart Baitani. He has an organization which is located in Bukoba. So we had initial meetings and we are working on it. The same thing, we're going to be doing the training and educating for the healthcare workers. And then so we try to do as much as we can. And he has a very good structure already set. And then so he always welcome the volunteer. So, and of course our organization is definitely to provide education and training to sustain the clinical competence for these healthcare workers and community outreach. So we welcome anybody. You don't have to be in healthcare worker to be in the organization. Anybody, we get anybody who, as long as you're willing to go and help somebody else, then yes, you're welcome. Okay, so I am gonna, any questions? I know I went through a lot before we start talking about the next, this year. Any questions? Anybody?
No.
Okay, before I forget, I know we had a lot of, I mean, of course, working with the healthcare workers, we had a lot of issues with COVID, and we did a lot of training last year with COVID for healthcare workers here globally and stuff. And so as an organization, we send our condolences we lost a lot of healthcare workers and the other family members and friends. And then so we are touched, and we know our work has a lot of risk. So we thank everybody who was able to work through and help their family members or do their work at the hospital or clinics or wherever you can do, even in the community, teachers, of course, being out there and all this stuff. So we all sympathize with that. So the world is full of all these challenges. Now, of course, there's a war out there going on. People are going to be displaced. Healthcare issues is going to almost go to the roof, and people are hurting every day. So we say a prayer for everybody, and I know there's some people who are affected also in this group that they have family members over there. So we send our sympathy and wish and send you the prayers for healing and be able to, if we can help, you can just let us know. But if there's anybody who wants to say anything about those challenges that are going on right now. Anybody? Somebody?
I was gonna say it's so scary, and it's really like affecting, you know, the world globally, including like ingredient supply all over the world. So it's just a really, I mean, of course, people's lives are the most important, but it's also going to be affecting, you know, worldwide supply, especially of food.
And we need food. We need food. Thank you, Mr. Esther. What do you want to say? Okay. Okay, thank you guys. So, okay, let's go to the next part, what we're planning for. And it's from the website, Dr. KARIBUNI QHSC. So I want to say a special thanks for our board members. And then, so they've been with the organization from the beginning. We started with Mr. Gilbert Gaboni, who has been the vice president since from the beginning of this organization. Thank you for your contribution, and has been a very active member. And then, so we have Ms. Anne Schneider, Also, she was the secretary for the US part. So thank you very much. And oh, she's the one who's doing our social media. If you get to see like a Twitter or anything else going on there, so she's the one. So I'm sure the young people in the group might be joining her. So she does the Twitter and the Instagram, and I don't even know how to use those. But thank you, Ms. Annie, for doing that. And I know some people will come and join you and help us. Mr. George Gabon, who has been an IT person, and thank you for being on the initial board members for this organization, and we're gonna continue needing your help, so don't go too far. Ms. Kisa Mokalinga, so thank you for being the treasurer for this time, and we still need your help. And she's a nurse from New York City, and then so thank you and for all you've done for the organization. Ms. Jessica, this is the side of Tanzania. She's secretary from the other NGO from Tanzania, and she's been an instrumental person for people who went to Tanzania. She's been an instrument to help us logistically how to survive in Tanzania and in Dar es Salaam. Of course, thank you, Ms. Jessica. She couldn't come today. She has a prior arrangement for things that she needed to do. So thank you, and she still continue doing whatever she needs to do. Dr. Oscar Gaboni, also from Iringa, and he's been the chairperson for the NGO on the other side of Tanzania. So thank you for everything you've done and for your support in your ideas and the leadership from Tanzania. So thank you very much. Ms. Chira Kiyaki, and she's been also from community outreach from Tanzania side. So thank you for all your contribution and support for the organization. So in saying that, yeah, so we have the new board now, which is going to take over and try to continue doing what we've done. And then so the previous board members will help us continue and advise what we need to do. Can everybody see everything? Can you see board of directors?
Yeah, it's clear.
Okay, thank you. Okay, so we do have, other than the initial board members I mentioned, they are all going to be the advisor of the QHSC. So they're going to continue in a different capability of supporting the QHSC. We need their guidance because they were there from the beginning and they know what exactly the mission for the organization. So again, thank you for your time. And then so the person I didn't show up there was Ms. Irene Gabon. Also, she was the advisor from the beginning, so she's going to continue with that role. So we are going to announce today the new board members, Dr. Gwen Randall, and her area of expertise in operating room programs and etiquettes. So she's going to be worried everything anesthesia, and we have plenty of things for her to do. And she's already in a group of all the anesthesia, so to try and identify areas that we need to address. So as part of the organization, that is the area that we need to focus on, because in Tanzania, they would identify and saying that they need help. So we do need a board member who has that expertise so they can share their knowledge and expertise to try and improve and improve the clinical practice for all the healthcare workers there. Dr. Ian Sambichaka, she is a pediatrician and internist here in the United States. So she's gonna lead the area for consulting group, which is all the health screening and pediatric issues. That's her. So, and she has already her team right now, Dr. Fabian Gilo and other people who are going to be added to the group periodically. And then so Miss Nancy Littner, she's a diabetic consulting, and then she's also her area's corporate sponsorship. She did help us secure the other two sponsors, and we're going to continue to do a little bit more aggressive to try and get those corporate sponsors to try and help us run the organization and support the medical mission. So for anybody who knows a corporate area that they might be willing to support us, please let us know. And then Ms. Nancy Littner and we can work on it to make sure we get those support. And if you want to work with Ms. Nancy Littner to that area, please let us know, and then we can tag team. So every expertise, every support is needed. We welcome everybody to help us. Okay, and then so for the executive team, Mr. Pranka Siakabe is going to be the vice president. And then so Ms. Valentine Dantes, she's going to be the secretary. This is for United States side. Ms. Catherine Dudek, she's going to be a treasury. And then the rest of them will be the advisors. So these people have been notified and they have accepted their role. And so we are expecting them to provide the expertise to grow this organization and continue to do great things. So for future activities, we do have a lot of stuff. We need to encourage more members to try and join us. So remember, it's great to work in numbers. The more we have, the more we can try to help the world to contribute for what we can do to help the vulnerable population. So if you have somebody you know that they might be a willing participant to come and join us, and they are always thinking and passionate about volunteerism, yes, because this area usually we don't make money. We whatever the money we get, we try to help other people who are at risk or vulnerable or disadvantaged compared to us. So whatever little you have, we appreciate, and we can go and use and help everybody who is. Okay, so some exciting news now. And probably everybody was waiting for this part. So the medical mission for 2022 is going to focus almost in 8 areas. And all those 8 areas is going to be big. So we're going to be in 3 acute setting, and then 2 community outreach, and then and some people will be rotating through those areas. So we're going to be at the Mumbai hospital, we're going to be at the Monanyamala hospital, and we're going to be at the Buguruni Health Center. So we do have specific people in the specific area, and then as I said, we start growing those teams, and then people can join in as we continue. So for Muhimbili, we have burn units. That's why I was talking about area that Miss Victoria last medical mission, she went and worked with Dr. Mrema in that unit, and we realized that we can do more and you can offer more support. So they've already started working on it. And as I said, if you're interested to go and work in the burn unit, what about the wound care for these patients over there? And of course, we worry about more kids. But if the kids have burn, there's a lot of psychological and nutrition-wise, and just the self-esteem as a child, having a burn area, and then they need support. So we do need a lot of people who wants to volunteer to those areas, and then so we can focus on those areas and provide the best services we can. Training, of course, we're going to do the training from now until we get there, and then once we get there, we go and almost finishing up, evaluate what we've been doing throughout the year until we get to the medical mission. So again, at Muhimbili, we're going to worry about, focus on the area of the Nicu and OB. So for the Nicu part, we have Dr. Robert Mushiro, that's I believe is the director of that area, or is the leader person from that area. He's the one who gave us the tour when we went last medical mission, and he showed us areas that we can contribute or support. Training, of course, is every common theme for everywhere. So Dr. Msambi Chaka, of course, is going to be on that area. And then Ms. Nuri is the nurse practitioner. Also, she's already on that area. So right now, for example, they are working on neonatal resuscitation for provider. Like this is the training that we provide for healthcare workers to take care of the baby who's compromised at the delivery. And what do you need to do to make sure the baby survives? So limited resources is one of them, but also clinical competence is another. So even if we have limited resource, if your clinical competence is at least up to par, then you'll be able to be more critically think and provide care for these babies and save this baby's life. Remember, our goal is to save at least 1 baby. So if every volunteer save 1 baby's life, so then we can do a lot better. Pediatric also, Dr. Msambi Chaka and Dr. Fabian Ngido, those are the initial people, but there's a lot of people who are going to join in on those teams. We're going to do the health screening. So that's the same thing. We're going to do health screening, like physical assessment for these children. There's 800, the school is called Minazini. There's 800 children who I believe they've never had any physical exam by a physician. So we do need to change that. So I asked Dr. Msambi Chaka and Dr. Fabian to get creative, and because those kids need assessment, physical assessment when we get there. Also, they're going to, of course, address with the athletes. So there's a lot of scheduling we're going to be including. So the more people we have, which will make the job a little bit easier. So we need more volunteers for that. Of course, nurses, anybody, even if you don't have to be a healthcare worker, there's a lot of work that you can do, logistic stuff. You can come and help and be tag team on any team that needs help, logistic, taking the names of the people who are coming in, identify their diagnosis, write it down, maybe the height and weight. All those things, people should be able to do that part. So we need help. Obstetric, of course, when you have the Nicu, you have to address the mom. So we have Mrs. Spuna Mbilini, that's one of the nurses from Buguruni, and we have more people. There's few contacts working on for Muhimbili, and I do have Dr. Saveri Benera from Wananyamala, so we're gonna add her name there. So we do need to worry about the postpartum hemorrhage for these moms who are delivering these babies, and unfortunate, they end up dying themselves because either we did not stop their bleeding too soon, or we did not identify them at risk before they deliver, so we can prevent it. So we need to do a lot of training before we get there, and then once we get there, we need to do those drills. For Wananyamala, we have Dr. Very Banera, and we start working behind the scene with other physicians and nurses to try and get the training up, and there's more people going to be added to the groups to address that part. And then of course, operative in anesthesia, this is Dr. Gwen Randall, remember she's our new board member, sorry, board of director, and then also Dr. Moses Mulungu, that's from Mumbai, and Mr. Bashiri from Wananyamala. So that's an initial team, but we are still building that team. So everything anesthesia, you know, preparation for going to the operating room. What do you need to do for, I mean, even nurses who are included in that group, what do you need to do for a patient before they go to the operating room? Do they have a consent? Do they know what procedure they're going to be done? What do they do after the procedures? What do they expect? I mean, all those education has to be done to make sure we educate colleagues in Tanzania. And then of course, our goal is to make sure the patients receive a safe care. So there's a lot of stuff to do there. When I mention these names and these teams, it does not mean that if somebody wants to work in both teams, we're gonna say no. If your expertise fits in there, definitely, please, we can help, and then we figure out the schedule. Buguni Health Center, so we have had Ms. Dina Komakoma, she was an instrument person last medical mission. She was one of the global volunteer and did an excellent job. And she has been a very hard worker person to try and get information about the Buguni Health Center. She's provided and identify educational needs and the clinical deficits. So we are going to address those things. And again, they fit on those different areas, and we are still, we're gonna try to get people to go and help them in that area. And then of course, the Magnet Youth, that's the athletic area. And then of course, another new area that we didn't have previously is the vision screening and eye health. Thank you to Dr. Vanessa Stenville. She's an optometrist from here in Florida. And then of course, we were already connected here with Dr. Redempta and Dr. Selina Muhina, both from Tanzania and Muhimbili, to try and see if we identify the children who are at risk or needs help vision-wise, what is the follow-up? So we do need to have the physician in Tanzania to try and help us to try and address those issues. And she's gonna be doing the eye, the eye exams, and of course the glasses, and then of course the vision screening. Also, we're gonna add the acute screening. So we don't need, we need also people who are not healthcare workers to try and help that. We can train, you get the training before we get there. So it's not like you have to be an expert to those areas to go and do that. So remember, we have 800 kids, so I need a lot of volunteers. Please come and help us. And of course, Minazini Primary School. So that's the school that we have those 800 kids. We are trying to do the same thing we did last medical mission: hand washing, health promotion, disease prevention, and then toothbrush, dental hygiene. So all those things we need to do, those are the basic things. And of course, we know the child does not go to school without a school supplies. So we're gonna need a lot of school supplies for those 800 kids. We need to make sure we're gonna provide a list of specific things so we can raise and hopefully get these kids at least things that are similar to from the 1st grade to the 7th grade to make sure they have supplies for school. So it's a lot of ambition goal, but I know we can do it, because if we were able to do for 1,500 last medical mission, we can do it right now. So, but I need the help from everybody else. Without forgetting nutrition, Ms. Theresa Cooper, thank you again for joining us. So we are going to address the nutrition on all those areas, starting with the band. We do need to, they do have a specific type of food that they need to feed those children, patients. So we're gonna also add, if you have any suggestion, we're gonna show you that part so you'll be able to share your expertise about what type of food for a patient who has burn or experienced burn, to be able to rebuild or regain their strength or gain their muscles or grow their tissue. The Nicu, of course, we need to discuss moms who are delivering those babies too soon. Is it because of nutrition? Is it because they have an infection? They need to worry about their weight. All those nutrition that they needed to address for their gestational diabetes moms. Okay, so do we need to address the diabetes before, and what type of food they need to eat as a diabetic patient? So all those things, so then when we reduce the trauma, which is going to lead to postpartum hemorrhage. I mean, we can go on and on and on. For pediatric patients, we do need, Miss Theresa again, type of food the kid needs to eat. And then of course, for vision, these children who probably don't see, I mean, cannot see, who maybe they're not being identified. Is it because of lack of nutrition that maybe leads to poor vision? I don't know. So we have Dr. Sambichaka and Dr. Fabian there and Dr. Vanessa Stenville to try and sort those things out. And then Theresa Cooper is going to jump in there and try and help us with that nutrition part. What type of food should we eat or encourage these children? Is it appropriate? Can it be found in Tanzania? So all those things, we're going to try and address that before we get there. So when we get there, we have a solid plan to be able to address that. And of course, for the primary school, Mrs. Christine Behuniak, she has done all our medical mission. Thank you very much. So every time we went to school, we rely on her expertise. So yes, we're going to need your expertise again. We're going to probably start working even before we get there with the teachers and planning of the activity, all those education. So we're going to wake up and to try and make sure we have a great sounding plan before we get there. And once we get there, things can run smoothly. Okay. Phew. So those are the plans that we're trying to do. As I said, we are ambitious. So any questions, anything that you was not clear or you want to add or you want to sign up?
I got some.
Okay, anything, any questions?
I have one.
Yes,
Dr.
please, thank you. Leave me.
Is there going to be a shipment available before we go over as far as school supplies and things? I mean, 800, 1,500 kids, but it's going to be a lot of supplies. So are we going to have a chance to ship some things?
Yes, so thank you, Susan. That's my next thing. So when we start recruiting people and start collecting stuff, which is going to start March 1st, we are going to try and target that we collect things by the end of May, and then June, I believe June 15 or something, they are going to ship stuff to Tanzania. So usually it takes up to 6-8 weeks, which is 2 months. If in June, so at least by August, they have the stuff. By the time we get there in September, we should have the stuff. Yes, we're not going to be able to carry now because every area that they go, for example, for the vision screening, I know Dr. Vanessa is planning to carry some stuff. Probably glasses is going to be one of them and other devices. So if we can ship those stuff ahead of us, then yes, that's the planning we're trying to do, yes.
I have one more question regarding that. All right, so if we collect a lot of stuff, for example, I'm in New York State, do I ship it to you and have it shipped from Florida, or is there a way that I can ship it directly from New York State?
So there's two ways, because there's a shipping company from Connecticut. Usually they put the dates. So if I know you have enough stuff to do, then yes, we can make arrangement that they can pass and get it from you. And then because they do, I believe they do every month going around the country. So, but I need to make sure I connect with them and do it, yes. So that's why we want to collect it as ahead of time. And the faster we get this stuff and ship it, yes. Because I'm sure until the last day, people are gonna donate. Thank you very much. We would never say no to equipment, to donation. We never say no. But if we can collect and send it ahead of time, so then we don't have to struggle like what we did before. Yeah, 26 bags was a lot. For people who were there, you will see, like, yeah. So if we can ship ahead of time, that would be great. And thank God we're going to be in Dar es Salaam only. So as soon as we land from wherever the airline we select to be, everything is going to be just right there. We don't have to ship them going somewhere else, no. And then so most of the time, the person who ships, they end up in Dar es Salaam, and then they keep it in the warehouse. When we get there, then we tell them which day we want those stuff. Then they will deliver to where we are. Yeah.
Thank you.
You're welcome.
I was going to ask the same thing. I'm out in San Francisco and just wondering if, like, in terms of preparing and fundraising and stuff, if it's better for me to focus on like raising dollars versus getting stuff just because of the logistics, or do both things help?
I believe both things will help, and then we'll be in touch. And I'll say, for example, if somebody say, "Oh, I'm going to donate," I don't know, since you are food person, I'm saying they're going to give 1,000 protein bar. That would be great.
Cliff bars. Okay.
So then we'll find the shipping company that, because I know they go around the country, so all I will need is just to get your address and then confirm with them if they can come and pick it up.
Okay.
Yes.
That sounds good. Yeah, I'm sure that I can get some Cliff bars donated, so that would be fun.
Okay, and then also for volunteers, we have to test to make sure they are safe for the kids.
Exactly.
Yes. No, thank you. I'm glad you agree. Okay. And then
Oh, let me ask a question. So, if I was able to collect a good amount of burn supplies, I could send that in prior to. So, what about I don't know, topical creams, soaps? Is that considered medication, or what?
I believe so, but we're gonna try to find out. So since we are blessed enough to have a lot of doctors in the group, so we will make sure we go through the doctors to make sure the ones who are here going with us, all these things are cleared, because for medication, we have to have the physician with us. And then if it's clear, and there's a specific channels that we have to go through, different groups we have to sign up to make sure that we are not going to sell or whatever. And then so once it's cleared, even before you get all those stuff, we have those stuff settled down, and then we can ship it or go with it with us, as long as we get the letter from the place that they're giving us. Yeah.
Okay.
And if you're in, for example, in one group, and then you have maybe your family members, friends, or whatever, they donate to use something else that belongs to a different group, that's fine. Just accept it, and then we figure it out how we're gonna ship it. If there's something bigger that you are buying straight from the company, before you buy it, I mean, hopefully we have the conversation, and then we can ship it. If the area you are at and they cannot pick it up from there, we can ship from that company to their warehouse, and then they will take it from there. As long as we have the documentation that we are shipping this and it's going to go from here to here, we should be able to do that. We've done that before, yeah. Okay, so when people are still thinking, I'm going to try to get people to know each other who is here in the group, and I see there's more people came in, so which is, thank you very much, everybody. Okay, so we're going to start with Miss Kristen. You want to introduce who you are and what you are thinking of doing in this medical mission?
Okay, hello everyone. I'm Kristen Behuniak. I've been with Dr. Gabone since 2019. I've been over to Tanzania twice and have fallen in love with Tanzania. So I want to continue going back to the schools and teaching the kids the different health preventatives we've discussed, and collect as much as we can for them, because those kids are overjoyed to get a pencil, to get paper. When I've talked with the teachers, that's been their biggest concern, is getting things as simple as pencils and paper and things for their students. So I'd really like to see that achieved. Is that good?
Thank you. Miss Catherine?
Hello, my name is Catherine. I am a registered nurse in Florida. I was to go to Tanzania last year on the mission trip, and also just fell in love. I love the people. I love how happy they are, and I love being able to go help such a vulnerable population. And I really look forward to raising funds and getting to know all of you this year.
Thank you. Mr. George?
Hello, this is Georgie Gabone. I don't know exactly what I'm doing, but I want to make sure that everything I mean, I'll do everything that to make sure that the mission is successful.
Thank you. He's been our IT guy. We gonna need his help, especially when we're doing the IT, so the virtual training and Zoom and stuff. So definitely, yeah. So thank you. Okay, Professor Brown.
Okay, how's that?
Yay!
Okay. Well, I haven't had the pleasure of going to Tanzania, but I've been doing a little bit behind the scenes and will continue to do that. Whatever Dr. Cabone wants me to do, I'm there to do it.
Thank you very much. She got the books and clothing that we took to the Congo. So thank you. That was lovely. And also she donated the breast pump. So which we, yeah, more like it's probably go to Muhimbili where there's the Nicu babies and mom. For people who are at the Muhimbili, remember they're hand express. So if we get those, if you know anybody who works in Madeira company, wherever, so we need those, like maybe 10 of them, that'll be great.
10? Okay, I'll work on that.
Yes, please. Okay, Mr. Raymond.
I'm Raymond. I'm an EMT in Virginia. I'm just excited to be part of this group here.
Thank you. We'll put you to work. It's the emergency room over there is not the same as here. So preparedness and getting the patient ready for one stop to another needs some education. So we might tap you to those areas, especially traumas and people coming in and out, transporting the patient, safety on transporting the patient. That would be great. So thank you. Ms. Theresa.
Hi, everyone. I'm Theresa Cooper from San Francisco. I'm the ingredients research manager at Cliff Bar and Company. So I work for a nutrition bar company. And I grew up with Miss Kristen in upstate New York. And I was so inspired by all of her stories and her passion around this group. So just super excited to join, hoping to help with nutrition guidance in the schools, hospitals, sports teams, wherever needed. And then also like really interested in kind of connecting the dots in agriculture too, and learning a lot about, you know, the food that is available in Tanzania. So just super excited about joining the group and meeting all of you.
Thank you very much. We need your help. So maybe we start nutrition assistant for the global volunteer first, and then we go over there. Okay, Ms. Valentine.
Hello, everyone. My name is Valentine, and I am in Florida, and also a recent graduate from South University. That's how I met Dr. Gabone, and I was so blessed to have heard about QHSC and join, and it was a pleasure going to Tanzania. I really enjoyed it, and it was one of the best experiences of my life, and I made my dad proud, so that's awesome. Yeah, and thank you for trusting me to be QHSC secretary. I look forward to doing all that I can to help us thrive and grow, because the more we grow, the more we can give back. So that's one of my passions in life. Thank you.
Amen to that, definitely. Dr. Mlao, Dr. Fabian.
Hey, everyone. Yeah, my name is Fabian Guido. I'm a pediatrician. I'm currently located in Tennessee. I got a contact to join the group from Dr. Msambichaka, and I'm very excited. I've been in Tanzania. I grew up in Tanzania, but I went to help the Muhimbili Nicu about 2-3 years ago, but I went individual. I'm very excited to be part of a bigger group, and I hope we can accomplish a lot more. So looking forward to the trip in September.
Yes, no, thank you very much. Karibu sana. So we are going to with your help, we're going to put you to work. You can see we're working with 800 kids.
Yeah.
The hospital also, we're working with the NICU and pediatric units in the Bani area. So all those areas, so we do need your help.
I'll be there.
Good. And you can see already in the group for the NICU neonatal resuscitation. So
right.
Of course, you're familiar from this side, but in Tanzania, they don't have exactly actual schedule, you know, like year, every other year to renew for the
Renew, yeah.
So they
Yeah,
do
hopefully-
get different training, but we need to change that. So we need to be able to provide that support throughout until we get there. So at least they will have some content educational wise, and then practice, return demonstration, and then be able to evaluate when we get there, like, you know, doing mark drill and stuff. So that would be perfect.
Right, right.
Okay. No, thank you very much, Dr. Fabian. Yeah.
Thank you.
Dr. Mlawa, you're next.
My name is Gideon. I'm based in London, and I work in diabetes and endocrine. And I've been trying to work alongside Professor Harriet in terms of supporting her work. And I've been to Tanzania before with different mission, but I met Professor Harriet in Washington in 2019. And therefore, I'm happy to support any work she's doing. And I'm happy to join this mission in the next, I think, for this year.
No,
Thank you very much.
Thank you very much. So Dr. Mlawa, I mean, I said we always have the education for the diabetes. And one of the areas that I believe is Dr. Benera, one of the area is the screening for the diabetic. And we always really need to do that, because we know for sure that's a risk factor with somebody who's postpartum hemorrhage. They're going to have a bigger baby, which is going to end up with the trauma and then end up postpartum hemorrhage. So that is one area that Dr. Benera really wants us to address. So we definitely going to address the diabetes and screening, and then postpartum hemorrhage is included that. So thank you very much, Dr. Mlawa. I know you have to go back, but thank you for coming back. Okay, thank you. Dr. Benera, Dr. Benera also.
Hello,
Hey, how are you?
I'm fine. Do you hear me?
Yes, yes.
Yes, I'm Dr. Zaveri Benela, a gynecologist for the past 10 years. I'm based now in Mwananyamala, but have been in several hospitals in Tanzania as a gynecologist, but also as a leader. I've been working as a district medical officer in Arusha for 7 years, and then I went as a gynecologist in Mbeya Regional Hospital. And for the past 10 months, I've been a medical officer for Mwananyamala Hospital. I'm glad for the coming mission, and I've been following up, and I'm trying to focus the areas which are being planned for the coming mission. When I look at the anesthesia in relation to mothers, especially if you think somebody who is bleeding will need to be operated, and then that link, I think we need to plan, because we have been losing a lot of mothers during operation, massive hemorrhage, and then they need to be operated. And then on the other hand, most of the operation for mothers, you see they have fetal distress, and then you need somebody to resuscitate the baby. Most of the training have been based in the labor ward, not considering that some babies are being delivered in the operating rooms, where you have a nurse going to pick a baby, but there are a lot of team there which are not trained into how to resuscitate the baby. So I think if we during our planning, I think if we focus, I think we can achieve more. I'm happy to be part of this planning team. I'm looking forward for the mission. Thank you.
Thank you very much, and I appreciate all the identify the area for training and education. Yes, I do agree with you. So it starts, for example, with a patient saying, yes, I agree with you that all those things have to work together, and that's why we have expertise on different areas, because at the end of the day, all the people work together and solve that one mom and one baby for those areas.
Yeah.
So I wanted to give an example, like a pregnant patient who is a gestational diabetes, the baby is too big, they go and deliver, or they have other complications, maybe they have to be delivered too soon. They start bleeding after the delivery, and then of course, we have to do a C-section and then bleeding. So then of course, they need to do, I mean, in America also, if somebody is bleeding too much, you have to do massive transfusion blood, which is most of the time is done in the operating room. anesthesia have to be there. So if we're doing the planning now with individual areas, but we're gonna have to be able to do as a group, because usually that's what we call a mock drill. Like at the end, we'll be able to run the code. Every person who is an individual in those areas have to work together to save that mom and baby. Yes, the premature babies, we have the Nicu there. Yeah, gynecologists, we have the mom who's bleeding. Anesthesia person, you put it under, you need to bring them back. And then of course, operating room, somebody comes to the operating room, you have to prepare and make sure that you guys are ready for that patient. So yes, we are identifying individual areas right now so we can have plan and identify specific education. But before we go to Tanzania, we're gonna have like that mock drill plan. When we get there, that's going to be probably 2 of them done in the hospital to make sure all of us have to work together and then run that mark, and everybody needs to know their roles. Here, you practice every quarter, you practice, and every single person, every single shift needs to know, okay, today I'm going to be a scriber, means somebody who takes notes and stuff. Today I'm going to be the runner, somebody who's going to run to get the blood and come back. Today I'm going to be like prepping the patient. So all those things, all those roles have to be identified before the patient crash on you. So yes, we're gonna have to work together, yes.
Asante sana.
Asante kushukuru. Okay, Dr. Fabian.
Hello. I had spoke unless you want me to say something else.
Oh, I thought you were raising your hand. I'm sorry.
No, I did not.
Yes, we need that. We need that expertise still going to the NICU with that baby who's yes. So yes, we do need to do those things before we go there.
I'll be happy to do that.
Oh, good. Ms. Sandube.
I'm here. Hi, everyone.
Hi.
How are you?
Good.
Yeah.
Hi.
Of course, my brother wanted to pop in. But yes, I'm Sandube Mwakalinga. I'm from Poughkeepsie, New York. I don't know if some of you have seen my mom on previous calls before, but she wasn't able to make it, but she said hello. I met Dr. Gobone. She's actually my godmother, so we go way back.
Since you were born, I was there.
Yeah, pretty much. But yeah, I'm just excited to be a part of these mission trips because I just graduated from pharmacy and I did a couple of trips like this in grad school. So I'm just excited to do an opportunity like this, especially in Tanzania.
Thank you very much. Yes, we're going to start picking up your brain. Definitely. We need a pharmacy. We need a pharmacy on board. And like what Lady Victoria was asking about, the cream and stuff to travel with. So if we have the pharmacist on board, we don't have to worry about that part. See, we have somebody who can justify their medication. So that's perfect. Thank you, Mr. Dube.
No problem.
Frank? Not you. Frank, name? Oh, he's the, oh.
Hi.
Hello.
Hi, everyone. I am Parank, and I am looking forward to working with everyone in the program and getting ready to see another part of the world and working with a lot of other kids.
Thank you very much. Frank also, he was an athlete, the same thing as Raymond. So we do have all those kids. They might need your help, physical practice and all stuff. We're gonna need your expertise on those areas to help them. With Ms. Theresa talking about the food with them, then you need to be able to exercise the right equipment, right exercise, and then all these things we need to do for the athletes. Ms. Dudek did an excellent job last year teaching them how to prevent those minor injuries. And so with those athletes, so that was an excellent area that you guys can join in and be able to do that. Who is there? Brenda?
Good afternoon, everybody. I'm Brenda.
Hi.
I'm a registered nurse in Georgia. I'm excited about the trip this year, understanding the culture, giving that extra hand. So I'm ready.
No, we appreciate it. Which area for nursing do you do?
Acute GI.
Nice. Okay, we put you somewhere to work.
Yeah, I might need your help. Just kidding, just kidding.
No, but we definitely we need more nurses. Yeah, we have, I mean, we are so blessed. We have a great group of the doctors coming now. We need nurses because we need to make sure we have, enough support around, and of course, the nursing, educate. So we do need help. So thank you for joining in, definitely. And if I don't have any information for like an email or anything else, you guys can put on the chat, just put an email so I'll be able to easily send the recording after we finish this meeting. So that would be perfect. Anybody who has not spoken or introduced herself? Oh, who are you?
Oh, I'm Parag, the father. And I'm a one-timer, unlike Miss Kristen. I'm a one-timer. And I think also, as Harriet mentioned about Raymond and Parag, they're going to be helping as well with social media. They're actually pretty good at it. And just so you can kind of get a little heads up or warning in advance, you got to remember that the younger they come, it's just done differently from what we're used to. So if you see that they're doing stuff and it seems like it's a little different or a little more liberal or flexible or whatever you want to call it, it's just because that's how the kids do it. And that is what seems to be, well, not kids, we call them young men. It's how the young people do it. And that's what seems to be popular and to gain traction and stuff like that. So.
In addition to that, thank you. In addition to that, for all those young people who are exciting with the social media, our plans right now, yes, we are doing education through the Zoom virtually with people in Tanzania. But when we get there, we need to be able to stream it live, either YouTube or Facebook or on the website. So those are the things that as I said, we'll discuss way before we get there, and it should be able to help us with that. So we want to be able, if we are there doing the training, then people from the world should be able to see those training. So that would be good. So if you have the talent, please share that talent. Anybody who has not?
Steve Jones.
Oh, Mr. Jones.
Prayer warrior.
Yes. We need all the prayers we can get. Mr. Jones?
Yes.
Hi.
Hi, how are you?
I'm good. How are you?
Pretty good. I got kicked off the line for a minute, so I don't know what you guys are doing.
No, just introduce yourself so we know who is in the group. Or if you want to pray, that'll be great. No.
Hi,
was our prayer warrior when we went to the medical mission. We needed that, and I believe we were safe because of all those prayers. We were praying every day or every food. So thank you.
Yes, I'm Steve Jones. I'm Victoria Jones' husband. I am, as they say, the prayer warrior, and we need prayer everywhere we go, because I think one thing about it, this is a mission that God has ordained, and has He ordained this mission, we need to have Him inside the mission. We need to do that with prayer. And I'm also the back carrier. Whatever you need me to do, we're going to be there to do it. Whatever we have to do, we're there to help and support. I believe this mission is very important. I believe that a lot of good things going to come out of it. So I'm here to help either way I can. Thank you.
Thank you very much. And also, Mr. Jones also did the logistic and like documentation and stuff. We kept all those documents that we do need, because when we come back, we have to document what we have done and tallies and things that we need to do for report purposes. So thank you very much. Yes, we'll definitely use your help, and especially as the group grows and we are reaching more people, different locations, and yes, so we do need your help. Is that Mr. Dr. Robert? When we are waiting for, I don't think I've let Miss Victoria introduce herself. Did I? Go ahead.
Hi, I'm Victoria Jones. I'm happy to be a small part of such a huge organization. And also I'm humbled to have been asked to be on the board of QHSC. So I will be there to lend my knowledge, skills, and abilities in burns, and happy to be doing whatever else is asked of me to do.
Thank you very much, and we appreciate you accepting that. One small story that we had from last medical mission, and I'm sure everybody who was there remember this part vividly, which we did not plan for it, but with God's grace, we were able to pass through one of the areas that we found a child who had severe burn. And all the global volunteers just jump into that and start addressing, taking care of that. Remember, we already given all the supplies, everything from every hospital we were, because we were like, yeah, we are going to Mikumi. Yeah, But that time, that child shows the burn was so bad and the dressing was not changed appropriately, or too many days passed by without being changed. And you know, if somebody has a burn and the dressing is not that clean, the next thing is going to infect and be infection. That child could die from the infection. So there's a lot of stuff that as a volunteer, when you see those things, we jump into gear and start taking action. So it was a beautiful thing to see Miss Victoria take the lead and take care of that child. And of course, it was the hesitation from the mom because, okay, all these people are from, they were Zungus, usually people who are not from Tanzania, they were Zungus, are coming to do and touch my kid. Why? Because they don't know. I mean, some people probably have come before and exploit the kids, who knows? So we had to do some negotiation and explanation to be able to say, you know what, we just came from the medical mission. And then I think some of us were wearing still the t-shirts. So then they're like, oh, okay, maybe that sounds legit. And then so they allow us to touch their child. And then Ms. Victoria was able to do her work and show it in the most resource restriction area, but she had a little things. We were able to gather around Ms. Catherine and Valentine, jump in and get whatever is left on their bags to try and share. So it was a beautiful thing to see. But those are things that it just makes me so happy to be able to get all these experts to who leave your activities to go and help these people who have no idea who you are, but still you lay a hand to save their life. So you don't know, maybe wherever you change that dressing, probably save that child's life. Who knows? But we're all just grateful for those stories like that. So thank you, Mr. Victoria.
Yeah, I would say that was one of my most memorable moments. I would say it was a moment of field expediency. Like you said, Catherine and I believe Valentine and a few other people, they were able to dig through their toiletry bags or their bags, supplies for their personal self, and actually piece together. I think Victoria kind of decided on inventing her own type of impregnated gauze or something like that or whatever.
Oh, yeah.
We gave the young man some snacks when he was there. The whole village or town is watching. And he's like taking a beating. I hate to use that phrase, but it's tough on him. But when he walked away from there, he was probably like the hero and now one of the happiest kids. I'm sure everybody was like, I want to be like him.
Yeah, so those are the things that you are expert, you may not think that maybe your expert is needed, or maybe in America almost everybody has the same expertise that you. But in Tanzania, every little thing that you do know, it could save somebody else's life. So that's why we say it does not mean that you have to be a healthcare worker. No, you can be just a person who is willing to lay a hand, to give a hand to somebody who does not have any help. So we do appreciate all you guys coming in. And of course, even if you cannot go to the medical mission, still you can help behind the scene. As I said, what Professor Brown was saying before. Yeah, you can do stuff behind here and then just help us to get there. And any help we appreciate and we welcome all the help. The person is Robert. Are you back? See that? There you go.
Yes.
Yes,
Harriet. Sorry about that. I was
that's okay.
That I could not introduce myself. But I'm Robert Koshiro, and I work as a pediatrician in the neonatal unit at Mumbai National Hospital, and we were glad to host the group last year, and I think we will have some very good plans to have you again in September, so you are warmly welcome.
No, thank you very much. Yeah, you gave us a great opportunity to be able to see the Nicu from inside out. And you can see there was a lot of the nurses there. And everybody was in tears just to see the babies there and how much support is needed. And of course, you guys identify some of the education things that which we definitely going to address that before we get there. So thank you for that opportunity, and thank you for committing your department to try and work with us. So thank you.
Yeah. Karibu-san.
Asante, yeah. So anybody has anything to say, and I'm sure everybody knows who I am. My name is Dr. Haiti Gabone, and I am so excited and happy to go and take all of you guys back to my home country and try to help. As I said, my goal is to save just one life, at least one life. So if I have 50 of you to go, at least 50 lives will be saved. So thank you very much. And I encourage you to sign up for all this. Every time we post those activities, or if you have an interest for those areas that I mentioned, just let me know which area you're interested in, then I will add you to those groups when you're doing the preparation. And of course, March 1st, we're gonna start doing the recruitment to try and recruit people from different groups. And as I said, don't feel bad that, oh, I don't have that expertise on that. No, if you're interested to work on that area, that's fine. Or if you're just interested to join the team and then you want me to select where to put you, we have a little conversation to try and find it, because I want you to make sure you get the same experience than everybody else. So I want you to fit you to the area that you'll be the most impactful and you get the most back to you. So it doesn't have to be a specific area, but let me know, that's fine. We can use extra hands and all the resources. And again, we're gonna need help with raising money and supplies to get with us, because they don't have things that here we take for granted in the United States. They don't have it. They don't have it. So anything that we can get, especially those protein bars, that'll be even better. Okay, so if anybody has anything else to say, once we finish this meeting, I'm gonna try to convert it and then send it to everybody and then post it on the website, social media, and put on all the emails you guys gave it to me. So I'm gonna share. And if you can share to everybody out there, that will be fine. And as I said, thank you again for giving us this time and share your expertise and willingness to help the other individuals. So
We're gonna try to be really quick.
everybody, thank you. If nothing to say.
Tutanana badai.
Yes, and there's a Swahili learning group. So if you're interested in learning Swahili, let me know.
Yeah, you'll see the information. We're Jessica Mkoni volunteered to see if she could get a Swahili teacher for us for the next meeting. I think we're doing pretty good on our way to learning, but if we could get a little more of an understanding and maybe a little more guidance, that would be helpful too. So we'll send it out in the group chat. Hopefully everybody will join us.
Oh, and if you are not in WhatsApp group, there's a QHSC WhatsApp group that we give all these updates, all the recording updates and stuff is gonna be in there. So if you're not in that group, let me know, then I can add you there, or I can give you the link for you to join. So you get all the updates and discussion, so you are updated for what is happening. And if you have any question, just ask the question in there, then we provide the answer as soon as we can. Okay?
Okay.
That's my story.
Alrighty.
Thank
Bye,
you.
guys. Thank you, everybody.
Steve, talk to you later.
Thank you, Brenda.
Bye,
I'm
thank
good.
you.
Bye, George.
It was nice
Hey,
seeing you,
Frank,
Professor
I'm gonna text you.
Nice to see you too. Bye-bye.
Thank you, John.
Bye, everybody.
Bye. Bye, Michelle.
Bye-bye. See you soon.
Thank you.
I know that it says it.